Well, more often than not, many people fail to address the root causes of what's going on, and that may be injuries to some of the joints within the spine. Taking anti-inflammatories and physical therapy may help temporarily, but it's not really addressing the root issue. Sometimes that could be excessive movement of what's going on in the spine. It could also be nerve irritation, which is not being properly addressed. And also, it can be poor biomechanical function of the entire body itself. So, just movement in general becomes really important. The common things that we see is it fails to address the root cause of the problem, and a lot of times it tends to be excessive movement of some of the smaller joints within the spine. And then number two, it can also be the irritation of the nerve, which can be caused by that excessive movement too as well, or even potentially disc that could be touching the nerve root as well. The last thing that's really important is biomechanical function of how you're moving. So if you're not moving very well and there are muscle imbalances, you're going to continue to have the problem. Well, more often than not, many people fail to address the root cause. One of those causes can be excessive movement of the smaller joints that are in our back. That's one thing. The other thing that also can happen is that there can be irritation of the nerve roots in and of themselves. And then lastly, there also can be muscle imbalances that we're not addressing. Well, more often than not, we don't get to the root cause when you're doing that. A lot of times the root cause can be because of excessive movement of the joints and also imbalances within the muscle ligaments and the tendons. That's important. The next thing can be also irritation of the nerve roots in and of themselves. And then lastly, muscle imbalances also need to be addressed as well. There are other options that are non-surgical. And that's what we do in our office, where we try to address more of the root issues. And as mentioned previously, that can be some of the excessive movements of the ligaments, tendons, and the joints. And that's where things such as platelet-rich plasma, stem cell therapies can help address that. Surgery also, if it's done, ultimately can lead to more problems down the line, and you may still have the issue. There are other alternatives to sciatica and back pain. One of those actually is regenerative medicine, because that actually addresses a lot of the root issues, which are excessive movement of the ligaments, tendons, and joints, which lead to sciatica. And in our office, we do this where we utilize platelet-rich plasma or stem cell therapies to help stabilize the spine so that you no longer have sciatica. Surgeries also can lead to more long-term issues where you can continue to have the problem and may potentially need further surgeries down the line. Well, one of the things we do in our office, and it's been stated before, is that we really try to address the root issue. In many traditional clinics, what actually happens is that there are only temporary fixes that are given, whether it's pain medications such as narcotics, which can make you feel sick and tired, versus steroid injections, which are only temporary, but don't address any of the dysfunction within the spine itself. It doesn't ultimately lead to a better outcome. Regenerative medicine therapies such as platelet-rich plasma and autologous stem cell therapy do address those issues, where we are stabilizing the spine and therefore preventing the irritation that's in your back and causing the sciatica. PRP stands for platelet-rich plasma, and that's when we take your blood out. We use a centrifuge to spin down the blood, concentrate the growth factors, and then we use ultrasound guidance to inject them back into the areas of damage. I've been proof positive of that, where I've had my own injuries, and I was actually able to go back and play sports such as basketball and even exercise again. But for any golfer who's out there who feels like they can't get back there, these treatments can be great for that, where you don't need to have a surgical option to get better. Well, with the regenerative treatments, most people can expect to start seeing some difference at about 4 weeks. More often than not, most people will start seeing major changes at 2 to 3 months. This is something that I have gone through myself, where I've noticed the same exact thing. But it does take some time for you to actually heal. Most people will notice a difference at about 4 weeks. Sometimes people will see a major difference at 2 to 3 months, but what really drives a lot of this is your age, how severe the issue is, and what was your activity level prior to all of this as well. But most people should expect anywhere between 1 to 3 months. Unfortunately, I see the MRI miss things quite often. Many times the MRI actually does not match up with the individual's actual problem. And that's actually when they get sent to me, and we have to try to dig and figure it out a little bit more. A good physical examination is always going to be important and inevitably always trumps the imaging. Many times it actually misses where the pain is coming from. I see this a lot in my office, and many times it does require to have a good physical examination to try to help figure things out and see where the actual pain points are coming from. And sometimes it may actually need some additional imaging, potentially, depending on how the physical exam turns out for the patient.